Hey everyone, it's Dr. Brooks. This is going to be our cranial nerve and dermatome lesson. So let's dive right in. Cranial nerves. So you can find a plethora of pictures on Google and the internet to show you the cranial nerves. This is just one picture I have here. Main thing, just kind of showing you all the different places the cranial nerves go. And that if really it's underneath the brain coming out from there. So we're not getting into like knowing where all the foramen are, where they come out or anything like that right now. Just we need to have a basic understanding of kind of like what we should see if everything works okay or how we can tell there's a problem. So remember, the cranial nerves are actually part of the peripheral nervous system, right? So let's see. So again, you can find all the pictures you want on that. I just want to get into telling you a little more summarized of what each cranial nerve does. You're going to need to know the names of the cranial nerve. You're going to need to know which number. And honestly, the tests are going to have Roman numerals. So if you don't know Roman numerals, you're just going to have to learn them. And I can help you. Let me know. Talk to me about it. But that's just the way it is. So cranial nerve 1 is the olfactory. And we need to know whether or not they're sensory, motor, or both. And I'll talk about an acronym that you can use for that as well. So olfactory, sensory, this is going to be smell. How do we test this? Well, you need to use something that's non-noxious, and it should be non-noxious for the patient. So leather, coffee, and citrus are generally 3 things that are okay, but I know people who, for example, coffee gives them a headache or a migraine. It triggers it, so you need to be careful about that, so talk to them. I find this one, we don't really, in therapy, physical therapy, we don't need this or talk about this. However, there's a lot of good information that's starting to come out about using the olfactory system as a way to predict or catch Alzheimer's, Parkinson's, even in the very early stages. And if you've been paying attention to anything dealing with the COVID virus, one of the major symptoms is a loss of smell, which I find interesting. I don't know much more about it, why you lose the smell, whatnot, where along the chain of smell and understanding that happens. But in general, I think the sense of smell is one that is often overlooked. It's a very primal, basic sense of smell. It's the shortest route right into our brain, and it has the longest memory of our senses. So I think it's kind of a neat thing to kind of look into. So moving on though. Optic, also sensory. So cranial nerve 2 is the optic, and this is your actual vision. So using the Snellen chart, okay, having someone look. Now you're not an eye doctor, but that's kind of how you would test that. And some of these are going to overlap, and when I show you the testing, it'll help you, it'll show you how you can kind of simplify that. And for an exam, main thing I would start with is just knowing which ones, for example, now are going to deal with the eye and whether it's sensory or motor. So if you have damage to cranial nerve 3 or 4 or 6, abducens down here, you're going to have issues with motor movement of the eye. So ocular motor helps with pupil reflexes. So you take like your pen that might have a little flashlight, start away, slowly bring that light in, and you should see as the light enters where the pupil is going to constrict, okay? Trying to reduce the amount of light coming in. Also helps with elevating the eyelids, opening them up, and moving the eyes up, down, and in. Trochlear helps with moving it down and in as well. And the abducens, cranial nerve 6, helps abduct the eye. So here's how you would test it. If you look at the board down here, what I would do is they follow a pen, right, or your finger. You should make an H and a V. If you go through those patterns, you'll hit all of the motor cranial nerves. So if I'm here, I would take this and I would go H, back up halfway, back up to that corner, down, and up. That's what I would do to check all 3 of those. Then you have the trigeminal, which is facial sensation. So doing that light touch to the face. And mastication. So it's a both. It does sensory and motor. So chewing, the jaw closure, okay? You can literally just bite down. There you go. 7, don't confuse this with the trigeminal facial sensation. Even though the facial, cranial nerve 7, is both, it does not do sensation of the face. It does motor of the face. So can you puff out your cheeks? Can you smile? Those things right there. And then in terms of sensory, it's the 2/3 of the anterior tongue. So like sweetness, but you don't need, we're not putting anything in anyone's mouth or anything like this anyway. So, but just understand you can get some of the tongue sensation comes from cranial nerve 7. Cranial nerve 8, auditory or vestibular cochlear, has multiple names. This is sensory, hearing, first off. So you take a tuning fork, start out wide, so you bang it over here, bring it in, see where they, and then to the other side and try to get it symmetrical. See what that's like. And vestibular balance. So you can do things like the Romberg test and other balance. We have a zillion different ways to challenge balance. Cranial nerve 9, glossopharyngeal, is also a both and is the vagus. So with these, how you would test is phonation. So going ah, that's why the doc has you go ah and swallow. If you go ah and swallow, and the gag reflex, which again, we're not putting anything in anyone's mouth, those things are all part of the cranial nerve 9 and cranial nerve 10. Now the sensation for the glossopharyngeal is the posterior third of the tongue, and for the vagus, it's also a major controller of the parasympathetic nervous system. Then we have cranial nerve 11, accessory, and that's going to help with elevation because it's those upper traps, and SCM for rotation. So you can just do a shoulder shrug, try to press down, should be a 5 out of 5 MMT, easy. And hypoglossal is motor, that's the tongue. Have the patient stick their tongue out, move it side to side. If they stick it out and it drops to the left, then that's the side that is affected. But even if you don't remember that, you'll know that like, well, if the tongue comes out, falls to the side, something's wrong, okay? So that is how you will test the cranial nerves. So you need to get good at being able to run through that. So pretty simple. Not that you have to diagnose anything specifically, but you should be able to run through a basic list of cranial nerves, especially thinking about if you're working with athletes and concussions, to run through some of those things really quick to see if there is damage to the brain or the cranial nerves. And I told you I'd give you an acronym for the motor, sensory, or both. Here you go. So this is one I learned. Some say marry money, but my brother says big, brains matter most. Now you can make up your own acronyms. There's also acronyms for the cranial nerves in order. So whatever you need to do. One of the ones for the cranial nerves, there's one that's inappropriate. I don't care what you use though, but there's ooh, 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 to touch and feel a green vegetable, ah. That's another one. So for the cranial nerves, and then you have the motor, some say marry money, but my brother says big brains matter most. That should help you remember whether or not it's sensory, motor, or both. You need to know those things. You also need to be able to say the cranial nerves in order, because if I'm your instructor, you're going to be saying them in order on one of the exams. So get ready for that. All right. Now dermatomes. So now we need to be moving our sensation testing to specific dermatomes. Instead of just doing it all over the arm, we need to start looking at specific dermatomes so we can tell which level of the spinal cord might have issues. So I think one of the easiest things to do is to think of major landmarks, okay? So when we're looking here at, say, C6 down in the hand, we should be able to think of the thumb. C7 is going to be these two fingers. There's plenty of information out there that's going to have the middle finger be divided, blah, blah. There's not going to be a test question about the middle finger. So these two are going to be 7. Those two are going to be 8. You know, you start finding like T4, nipple line, cross there, okay? So we should be able to go through and paint on ourselves all of the dermatomes, okay? You're going to have to do that for a checkoff. So finding those landmarks will make it really easy. And then on the practicals, you're going to have to do sensation testing to a specific dermatome. And I want to make sure we understand, if we look over here to the second picture, that dermatomes are not left and right side specifically. The dermatome is like a graduation cloth that you would put around. It goes around both sides. So if you're doing C6, we need to be doing it all the way back around into the other thumb, okay? Like a cape across both sides. So we get down to like L1 into the groin, L2, L3. Then you got L4, and that's going to go over the kneecap. That's a good landmark. And these are just ways to start. You can get more detail, but you know, how do you say you eat elephant? One bite at a time. So one thing at a time. So L4, there you go, could be the kneecap. L5, it's most of the toes. And then the bottom of the foot. Okay? S1, you're going to have the lateral malleolus. S2 is going to run down along a little bit of the bottom of the foot. So there's multiple different books that are going to have a little difference of where the dermatomes are. I just have this picture right here. But whatever book you have, just learn those dermatomes and then be able to start applying all the sensation testing to those. So that's why I say start with major landmarks first, and then you can work on that. So that is a quick rundown of our cranial nerves. So we should be able to say them in order. We should know the Roman numeral. We should know whether it's sensory or motor, and we should know what the sensory and or motor is that the cranial nerve is involved with. We also should know how to test the cranial nerves, and we should also be able to do sensation testing on any dermatome. Now, you're not going to get any of the thoracic on a practical. That's silly. And you're not going to get, look at the groin, you're not going to get like S1, S2, obviously. So it's going to be things that are a little more appropriate for this stage of the game. So I think that's it. So make sure you study those, practice those things, and it might seem like a lot, but if you just do a little bit of practice, you're going to get it pretty quick. So, and I'll see you in our next video where we talk about the stages of motor learning, and that'll be next. So I'll see you there.